Hello, my name's Dr Vicki Woodward and I'm an obstetrician from the Royal Women's Hospital. With increasing numbers of COVID in the general community, it's very possible that you might contract COVID while you're pregnant. I'm hoping that this video today will tell you what to do if that's the case and who to contact if you're in trouble. Firstly, I want to reassure you that most women who contract COVID while they're pregnant will have a short, self-limiting and generally fairly mild illness. This is particularly true if you're fully vaccinated. There are some women who might develop more symptoms or might have more severe infection and who require more assistance. Generally, the women that we worry about being in those categories are those who are not fully vaccinated or not vaccinated at all, those who are older, those who are a little heavier in pregnancy, and those with pre-existing medical conditions. If you test positive on a COVID test, there are some things that you need to know to do and some things to look out for. Importantly, you have to isolate and notify your contacts, and you need to look after your own general health. As we said before, most women will develop mild symptoms, most of which can be managed at home. The most common symptoms that women develop with COVID in pregnancy are the same as any other population, the non-pregnant population. Sore throat, muscle aches and pains, a fever, headache, nausea, vomiting, mild shortness of breath, and fatigue and lethargy. You can use throat lozenges or warm tea or honey and lemon drinks for the sore throat, Panadol for fever and muscle aches and pains, and rest and keep your fluids up. Please note it is not safe to take Nurofen during pregnancy. Panadol alone should be enough. If you fall into one of the more high-risk categories, or if you feel that your symptoms are becoming worse, it's really important that you reach out for help. It's likely that you'll be contacted after your notification of your result by a doctor or midwife from your local health provider. This may in fact be the Royal Women's. The decision will be made based on your medical history and the number of weeks pregnant you are, whether you will have daily phone calls or whether you continue to self-monitor at home. But please know that you can call our hospital at any time if you're concerned. Other sources of help include, of course, your GP, local pharmacist, local general emergency departments, and the emergency department of our hospital, the Royal Women's, or the Royal Melbourne Hospital next door. Please do not hesitate to get help if you're having increasing shortness of breath, if you're unable to keep food or fluids down, if you develop severe chest pain, if you're generally not feeling well and not improving after some time. One of the other concerns that pregnant women have if they contract COVID during pregnancy is what will happen to their normal pregnancy care. We want to encourage you to continue your normal pregnancy care just as if you didn't have COVID, with a few slight changes. Please ring our outpatients appointment if you're due for an appointment so that we can either change your appointment to telehealth or defer it until after you have been cleared from COVID, whichever is more appropriate. Other investigations needing done during your pregnancy, like ultrasound, blood tests, can be discussed with us at the time, and we can again either defer those or organise for you to have those done at the hospital in a COVID-safe way. If you happen to go into labour while you're COVID positive, you can still have your baby at the Royal Women's and your support person can still be present with you. We have labour ward rooms set up specifically for women who are COVID positive, and we can take care of you in a safe manner, safely at our hospital. In summary, we know that most women who have COVID have a very mild, self-limiting illness and their babies are not affected by the disease at all. There are some instances where you might need extra help. Please know that we are just on the other end of the phone and happy to hear from you at any time. Stay well, stay safe, stay in touch, and let us take care of you.